Welcome, everyone. I'm Jeffrey Goodman, Director of Marketing and Development for the YMCA of Northwest Louisiana. We're here at 318 Latino Studios for Shreveport-Bossier, my city, my community, my home. And can't wait to have today's discussion. Our guest is Jordan Ring Scroggs. Jordan, good to see you.
Thank you so much for having me. I'm really excited to be here.
Well, I'm excited to have you.
Yeah.
Well, thanks for making the time. So that people know, you are the executive director at MLK Health Center Pharmacy on Olive Street, the oldest free clinic and free pharmacy in Northwest Louisiana.
Yes.
And I may get things wrong, so if I do, please jump in and correct me. But let's start at the beginning if we could. The founder of MLK Health Center Pharmacy was Dr. Robert J. Jackson, who in 1985 recognized a gap in our community. So my question for you is, talk to me about the origin of MLK Health Center and Pharmacy.
Absolutely. Yeah, I think it's a really beautiful story. So our work did begin in 1985, like you said, with Dr. Jackson. And at the time, he was the chief resident of internal medicine at LSU, so at the med school. And he, through his residency, was doing rounds at the emergency department. And through that experience, he started to notice this phenomenon where people were coming to the emergency department because they needed to find a provider that would write them a prescription refill on their blood pressure meds or their diabetes, their insulin. And it was just odd to him that they weren't going to their primary care provider. And there's a term within the industry that people who come on a regular basis to the emergency department for that type of care, they're called frequent flyers. I don't love labeling people, but that's what they're called. And so over time, he got to notice these frequent flyers, couldn't figure out why they were coming, but nonetheless, they were there. He was doing his job. And then, sadly, some of these frequent flyers who were coming for a blood pressure refill were now coming because they've had a massive stroke or heart attack, and he couldn't figure out why this is happening. So he just started to have conversations with these people that he was beginning to see on a regular basis. Why are you here? Why are you not going to your primary care provider? And that's when he discovered that they didn't have a primary care provider. They didn't have health insurance. And so the emergency department was truly their only access to care. And people with chronic diseases, they can live a healthy life, but they're not healthy in that they need to see the doctor on a regular basis. Like, they need consistent care. And the emergency department is not equipped to manage chronic disease. They're there to deal with an emergency situation and then immediately move on to the next one when that's been stabilized. So people are coming and they're getting the prescription refill, but they're not getting better, right? Their conditions are not improving. And he knew that there had to be a better way that we as a community take care of that population of people. But he didn't know how to do that. So he goes to his dad, and his dad sends him over to Sister Margaret McCaffrey, who was the executive director of Christian Services over on Sprague Street. And I never got the pleasure or the privilege of meeting Sister Margaret. She passed before I came into the story at MLK. But I've heard over and over the stories where, businessmen would see Sister Margaret coming and they'd close their doors because she was a woman on mission and she was prepared to do what it takes. And she comes to a businessman looking for a check. She wasn't leaving without that check. So she was a formidable force in our community. And Dr. Jackson has been very honest that when he scheduled that first meeting with her, he had no plan, he had no vision, and quite honestly, and he has been honest, he was really hoping he could present the problem to Sister Margaret, and then she would take on the crusade and bring it under the umbrella of Christian Services. But Sister Margaret had other plans. You're coming to me, there's people that need a doctor. You're a doctor. You are going to be their doctor. And she actually had him see patients that were clients of her soup kitchen that first meeting. I think it was 2 or 3 people. And again, Dr. Jackson, in his own, telling of his story, had no plan, had no vision, but had just made a promise to Sister Margaret that he'd come back on Saturday. And he'd come on Saturday and make another promise to come back the next Saturday. And the first couple of months, it was 2 or 3 patients because this was a man who was not from Better Heights. This community had seen it before. People come in wanting to do good and feel good about themselves, and they do their service project and they leave and they never come back. But Dr. Jackson kept coming back on Saturday. So within 6 months, this clinic of 2 to 3 people grew to 30 patients every Saturday at the dining room table of Sister Margaret's Soup Kitchen. That is how we started. And but through that experience, Dr. Jackson noticed another thing that was going on. So people are coming to him. He's diagnosing them. Okay, you have high blood pressure, you have diabetes, what have you. Here's your prescription. Come back in 30 days. Let's see how you're doing. And then they come back in 30 days and nothing is improving. Nothing's getting better. Why? What's going on? Well, then he finds out that they can't afford the prescriptions that he's writing, which becomes this bigger question of what are we doing? And why are we doing this? Because I'm not showing up, Dr. Jackson, to feel good about myself. There has to be a better way that our community can care for these people that need help. And I just so happen to have that skill set to take care of them, but they're not getting better. So he started calling friends that had private practices. He was going through the supply closets at the emergency department trying to find medication samples that he could take back to the soup kitchen. And after about 2 years of doing this at the soup kitchen, it became apparent the need is real. The need is not going anywhere. We have to do something more formal than, at the dining room table because, number one, it's a soup kitchen. So when mealtime came around, he got kicked out because that was their primary focus. And there was no privacy for one-on-one consults. They had no storage. So I think this was probably 87, 88, somewhere around that time frame. Christian Services donates a tract of land across the street on Sprague for MLK to build its own brick and mortar. And around that time came the real conversation of if we're really going to do this and really make this a thing, there has to be a pharmacy component. Because without the medications, no one's actually going to get better. So Dr. Jackson, Sister Margaret, who he will always credit as a co-founder, rallied some of the original founders. They go down to Baton Rouge and lobby the legislature for the first free and charitable pharmacy license, which we got in 91. So that allowed us to be fully operational in terms of having providers, having the medications that we could receive formally. The old Schumpert Christus system, they were a very big partner in the early days providing the medications. And and so that's how we got started. It was a meeting at a soup kitchen that turned into 2 or 3 patients that evolved into now we're coming up on 40 years of caring for our community, and we have over 1,800 patients. I think 50 different volunteer providers. It's pretty remarkable. But what I love about the story is for anyone who's watching, anyone who's out there that sees a problem, but they don't know what to do, well, go find someone who has more experience and wisdom. Go find your Sister Margaret. Be prepared to roll up your sleeves and understand it's okay if you don't know what comes next. Just do the next right thing. And I've always loved that about our story.
Yeah, it's incredible. Mm-hmm. Well, there's a tremendous documentary about MLK Health Center and Pharmacy that KSLA made several years ago entitled Chronically Heal that I recommend everyone seek out. You can find it on YouTube.
Absolutely.
I want to share a couple of the stats found in the documentary. The first stat is it is estimated that about 15% of residents of Northwest Louisiana have no Medicare, no Medicaid, no private insurance, and do not qualify under state guidelines for free care. The second statistic I want to share is there's between 40 and 45,000 uninsured adults in our area, and we suspect that many of them struggle with chronic conditions. So our community clearly needs you and the incredible work that you do. You offer a number of different services. My question is, tell me about all the different services one can receive when they walk into MLK.
Yeah, absolutely. So first off, we're a free clinic and pharmacy. And so the people that we serve are the ones that fall in the insurance gap. So they make too much money to qualify for Medicaid, but not enough to afford private insurance, and their employer does not offer them health insurance. And we work exclusively with adults who have chronic diseases. So we're not a walk-in clinic, oh, I think I have the flu, can I get a test? It's, I have diabetes, I need insulin to keep my job and keep keep taking care of my family and I need help. And so for us, that threshold is around 300% of the federal poverty line. So for a family of 4, that's about $6,500 a month before taxes. So it's more than people realize. I think a lot of people think, oh, free clinic, I have to live on the streets to be able to qualify. These are working families who are doing everything that they know how to do to take care of their families and their kids and put food on the table. I think everyone today with inflation can understand a little bit more deeply how hard that can be. But then imagine you're sick and you don't have access to care and you're constantly told, oh, you don't have health insurance, we can't help you. The desperation that those families feel.
Let me interrupt.
Yeah, please do.
The 300, say that one more time, 300%.
So 300% of the federal poverty line. And so that's set up, that's established by the government every year in terms, that's how they decide who's eligible for Medicaid or other programs offered by the government. And so we go off of that, and 300% is roughly the eligibility criteria for prescription assistance programs that are provided directly from pharmaceutical companies. And so we try to keep our eligibility kind of in line with that. So when people come to us, we can help them get their medications. I don't want to get off track from the question, but we have 3 main sources of medications for our pharmacy. So we partner with nursing homes. We have about 30 different partnerships with nursing homes and rehab facilities across Shreveport-Bossier that they're able to donate medications to us. So their clients, their medication is changing quickly, they're being discharged from the nursing home or the rehab, or the patient passes away. If everything is in date, they can donate it to us. And we're getting a huge volume of our medications from there. We have about a $20,000 pharmacy budget that we can purchase medications on our own, and then the prescription assistance programs. And they're called PAP meds. The PAP meds are going to be like your name brand, like your high-end medications that we just can't afford, and we're not guaranteed to get through the nursing homes. So all of that is to say that's why we're kind of around that 300%, and also because at 300%, you don't qualify for Medicaid, you're not going to qualify for the tax credit in the marketplace, and it's not enough money to afford it on your own. In the documentary they featured, I think her name was Miss Karen, she was a truck driver, had sustained injuries to her knees, had chronic illnesses, was going on disability, and I think there was like a 6-month period between ending her job in the trucking industry and getting her disability that she didn't have access. So she applied for Medicaid for that waiting period, and they denied her because she made $14 annually too much. $14 a year is not enough to go out and buy your own, insurance plan. And so
let me interrupt
there
one second.
Please do.
I watched the documentary, and it was incredible. I mean, just to hear her story, because basically for those 6 months, she just lived in fear, and she was very reluctant to do anything because she couldn't afford to hurt herself or to get ill or anything, because she couldn't afford the medicine or treatment should that occur.
And what we see too with this population that's in that gap where they make too much but not enough, people want to be healthy and people want to take care of their health. And what we've seen from people coming to us is, I couldn't afford my medications every month, but I scraped enough pennies together to get it this month. But instead of taking my full dose, I'm cutting my pills in half, or I'm cutting my insulin dosage in half, trying to make it stretch. And I think that's what Miss Karen was doing. But luckily a friend referred her to MLK, and we were able to enroll her for that 6 months. Until she got her disability, so she wouldn't have to worry about how she was going to get her medications. And in terms of who we serve and what we do in our services, I think it's important to note that we have people that we care for long term, and like we become their health home. Then there are people that come to us and they're in a waiting period, like I'm waiting on my Medicaid, I'm waiting on my disability, I've lost my job and I'm trying to find another one, and I'm just in this crunch period of trying to figure everything out. We can take care of them. We also have people, you'd be surprised that there are a number of people who come to us that are here on visas because their children are students at the med school or LSUS. So they're here on a visa, but that visa doesn't extend their insurance from their home country, and they have a chronic disease. So they come to us and we care for them for 6 months or so. So to be eligible, an adult, chronic disease, roughly 300% of the federal poverty line. And I say roughly, we're privately funded, so no state, no federal dollars, and that was a core value of Dr. Jackson's from the beginning, because he wanted his providers, the team of people that take care of our patients, to be able to practice medicine, to not have to worry about every 5 minutes someone coming knocking on the door like, hey, we need to hurry up, we got to see more people, it's all about volume. For him, it was about people and allowing the providers the space to practice medicine. But also realizing that real life doesn't always fit on a form, right? Miss Karen made $14 too much, but there's no wiggle room when it comes to government funding or programs, so she was denied. We have eligibility, but we have people that come to us that, maybe they're just a smidge over 300%, but we know that they can't qualify, that they can't afford the medications that they need. We make an exception because we're here to serve people that have nowhere else to go. So I say roughly 300%, so we have flexibility. The main conditions we treat are diabetes is a growing one. I think 70% of our patients have diabetes. And I'm also really proud to note that of the 70% that have diabetes, 53% of them are at their A1C goal, which is how we measure progress. I think the national average is 20%. And I say that because that goes back to that core value also of, are people getting better? Are we actually helping people get healthier? Diabetes, hypertension, cholesterol issues, mild thyroid issues, asthma, COPD, and then we have a women's health program. And the women's health program is kind of the asterisk that we have. Sometimes we see women who have Medicaid, but they just don't have access to the mammography service that they need. So they come to us. Partners in Wellness brings their mammography van on site. And Partners in Wellness would charge the insurance. We don't do that. But a woman comes to us. She doesn't have a chronic disease, but it's time for that annual cancer screening. So we provide that at no cost to women as well as their PAP. But we have worked really hard to make this a one-stop shop for our patients. So they come to us and they get to see a provider. Now, all of our providers volunteer their time, but our patients always see the same provider because that relationship is very important between provider and patient. We have a lab on site, so they're getting all their lab work done. We have a dietitian on staff, so they're getting that nutrition counseling because food is medicine, period, but especially when you have a chronic disease. We have the pharmacy on site, so they get their medications. Everything is at no cost to them. And we also do education around medication because Dr. Jackson, a lot of his research at the med school was around, oh goodness, now I'm having my moment where I'm blanking. It's patient literacy in terms of medical literature. Oftentimes you need a PhD to understand, the medical language and literature. So he's worked really hard to make sure that anything that we do, that we give, that we educate, that it's at a level where anyone can understand it. And a side story that I think is really interesting, again, Dr. Jackson just being perceptive. Medical literacy wasn't on his radar. That wasn't something he was thinking about, but he was at, what was the charity hospital called before it was Ochsner? Yeah, he was at the hospital, and a young teen mother came in. She had a baby with an ear infection, and he had given her some Tylenol, and it comes with a syringe when it has an infant. And he was signing off and walking out, and he just happened to look over his shoulder and noticed that she was kind of looking at the liquid Tylenol and the syringe. And he says, "I don't know why, but I just stopped." And I said, let's walk through how we're gonna give it to her. And she's like, "Well, I guess I used the syringe to take it out and I put it in her ear." She was going to walk out of there and put the Tylenol in the ear because she just didn't know. And that was very illuminating for Dr. Jackson, that we can never assume that our patients understand how to do these things because, particularly for MLK, we have a number of patients that come to us, it's the first time they've ever been to the doctor. And so making sure that we're always educating our patients on how to take charge of their health. And so medication plays a very big role in that. And so anyone who gets medication from MLK, we make sure that they understand what they're taking, why they're taking it, how they take it, and how they store it. which is really important. And through that process too, I'm rambling.
No, you're perfect.
Through that process too, we've been able to identify that some people learn visually. So we've got this really cool placemat that we put down. So, let's look at the label together. Let's read it. Let's do this. And, you can just, they're kind of glazing over. It's like, okay, well, let's put it out on the table and let's put it on, got pictograms and stuff. And they come alive. Like, okay, yeah, now I know what I'm doing. This is how. And some of our patients they're illiterate. They can't read. And we never want to insult someone's dignity. So if they can't read, then let's look at the pictograms together and let's make sure that you know how to take your medicine, because you deserve the right to know how to take care of your health too. So they get education. We have a couple of specialists that come either monthly or quarterly, and that's a program that we've really developed over the last couple of years. So we have an endocrinologist we have two that come that specialize in diabetes. So for some of our patients, they've had diabetes for a decade and never been diagnosed, and so their disease progression is pretty intense. So they get this special consult with an endocrinologist that's really going to dial in how to get their diabetes under control. We have a nephrologist for kidney, a dermatologist. We have a breast cancer specialist that will come for women's health. We have a rheumatologist who comes and does joint injections. So I think we're able to do quite a bit on site for our patients, so that when they come, they leave with a plan, with a relationship with their doctor, with their medications, and hopefully with the confidence that, yes, they have been struggling and more than likely have been struggling alone, but they have a team of people that care, that are invested, and that we're going to get them to a place where they can live healthy and well with their chronic disease. So,
it's amazing.
Yeah. I'm really proud of the work that my team does.
You should be.
Thank you.
Yeah, you are doing incredible things. So, you've gotten into this a little bit, but my next question is just for those in our community who are insured and who do not struggle with access to health care, paint a picture above and beyond what you already have of what life looks like for the uninsured, particularly those who have yet to discover or utilize the tremendous resource that MLK is.
Paint a picture. I think that we have a patient who was also featured in the documentary. He's still a patient today. He works at a gas station, and that's how he takes care of his family. But they didn't offer health insurance. But I think at the time of his diagnosis was like in his 20s and got diagnosed with type 1 diabetes, so that has to have insulin to survive. Like his body can't live without it. So this intense disease, needs insulin, doesn't have health insurance. I think he said that the insulin he was on was $400 or $600 a month. He didn't have that extra. But he, again, was able to get enough money to get 1 month's supply of insulin and then started rationing it. So instead of taking his insulin 2 or 3 times a day, maybe it was once a day, maybe every other day. And you get by, but your body, it's damaging your body. It's not getting what it needs. You have diabetes uncontrolled. You don't feel good. You have it can become nerve damage. You can have eye damage. You're lethargic. You don't feel good. So you don't perform as well at work, and you're not getting the promotions. It might be a little bit different for Ahmad, but in general, you have a disease. You don't have access to care. You're not operating at your best. You're not showing up for your family the way that you want to because you're sick and you just don't feel good and your body is run down. You're not, like I said, not performing the best that you could at work, and so you're not getting the promotions. And I mentioned that because we did have a gentleman, this was probably 5 or 6 years ago, came to us, uncontrolled diabetes. We got him on a regimen. We got him stabilized. He started to feel better. He started to perform better at work. And he got promoted. And when he got promoted, he got health insurance for his entire family. So for us, that was a huge victory. We were sad to see him go. But I think that just shows the importance of why this is important. Because when you're sick, you don't operate at your best. And you don't show up as your best for your family, for your job, for your community, for the things and the people that you love. So a lot of our patients are often having to make very difficult decisions on, do I fill my prescription this month? Do I pay my rent? Do I pay rent, but maybe only pay half this bill so I can get a little bit of, or maybe not all of my prescriptions, but the one that I really need. Just really hard conversations that they're having to have with their families, or they forego their medical care altogether, and then they wind up at the emergency department because they've had a heart attack, or they've gone into a diabetic coma and are having to have limbs amputated. And why that matters to us as a community is, A, I don't want to live in a community where people are forced to struggle alone, but they go into the hospital, they have a massive medical event, they get strapped with, nowadays, hundreds of thousands of dollars in medical debt that they can't afford. They default, it gets absorbed into the hospital system, and then it gets passed on to people who do have health insurance, because the hospital has to recuperate that money that they've lost, so it gets passed on to payers. And that was something that was true when Dr. Jackson was doing his rotations in residency. And that was another motivator for her. It doesn't make sense that we would kind of shrug our shoulders that there are people that are uninsured and chronically ill and need help, but that's not my problem. But it is. And I think we've seen also throughout COVID, we don't want our emergency departments bogged down with people who are not there for emergency systems, because it doesn't allow the emergency department team to operate at their best, because they're getting tied down with prescription refills and things like that. They're not there to do what they're signed up to do. And again, that medical debt gets assumed and then it gets passed on to us. And Dr. Jackson just knew that there had to be a better way as a community we address these issues. And that eventually became MLK.
It's amazing. And I mean, some of that is just so incomprehensible to someone who doesn't have to worry about that.
Absolutely.
So I'm gonna zoom out a little bit now from your work at MLK. So in addition to your critical role at MLK, you've been a strong advocate for the Shreveport-Bossier community. For instance, you started the I Love Shreveport Instagram and Facebook pages. So I'd like to get your perspective now on the larger community, on Shreveport-Bossier as a whole. And my first question for you is simply, as you look at our community, as you look out at our community, what concerns you the most?
Concerns me the most. That's a big question, probably a podcast all in itself. I think, and one of the things that I've learned from watching this podcast is just the immense talent that we have in Shreveport and people who are passionate. But I think at a systems level, I wish that our city would support these passions more and be more, I don't know if when I'm not political, I don't know if pro-business, but just more let's try something new. Let's invest in this new idea. Let's get people excited about Shreveport, because these people are here and they exist, and there's a will, there's a way, because people are doing amazing things. But I think that you have to overcome a lot in Shreveport to get these new exciting things off the ground. And I'm started a family with my husband, and we're raising our children here, and wanting this to be a place where they're excited to be. And like I said, the people and the talents are here. I just want to make sure that as a community, we're supporting those people and getting hyped up as much as the people on the ground doing the work.
I love that.
Yeah.
And then just final formal question, I'll come back to you after it, but final formal question is just on the flip side of that. What gives you hope just as you look out and as you look out at our larger community that we're headed in a good direction?
Yeah, it's a great question. So, a little bit about my story. So I was born in Alexandria, but for the most part, I've spent my life in Shreveport. Went to Byrd High School, went to Centenary, and then needed to spread my wings. And I moved off to Austin, Texas for a while. And, Austin's this vibrant, exciting city. And when I left Shreveport in 2014, I had no intention of ever coming back. And then that just weird, unique Shreveport pool that people experience, you don't experience it until you leave. And then all of a sudden you're like, oh, I miss Shreveport. I think I'm supposed to go back. And I came back, I think, 2016, 2017. And there were a number of people who had also left and come back with these ideas and these hopes and these visions. And they started to invest their own money and just decided that we are Shreveport. This is our home, and we have a responsibility to make this a place where we want our children to want to come back. And like, people have started putting their money where their mouth is and really just excited about being here and making this a place where their kids want to be. And so that's really given me hope that there are people who have left, have come back, who are investing their own money, their own business, their own time and their hearts into making this a city where people want to be. And I'm very proud of that. So I love Shreveport. This is my home. And through my work at MLK, I'm trying to do my part to make this a place where people are loved and supported and taken care of.
Well, you certainly are doing that.
Well, thank you.
Well, Jordan, those, like I said, those are my set questions. We have all the time in the world, though. If there's anything else, I know you so we go back from almost my start at the Y. I met you early on because we were already doing some collaborations with MLK that predated me. So if there's anything else you want to share, talk about, great. If not, no problem at all either. No,
I've really loved this opportunity to talk with you and share with our community about the work that we're doing. Sometimes there's confusion about who we are. The MLK Health Center on Olive Street, not the David Raines Center on MLK Drive, and David Raines does amazing work. We're not that clinic. But I think, or my hope is that through this conversation that people have learned that our center is not just for, people who are on the streets. Like, these are working families who are literally doing everything they know how to do their part to take care of their family. They're just coming up short. And so our center is there for, people that you might not expect. Know that if you've fallen on hard times, we want to help you. We want to take care of you. And we understand that it might just be a short period. It is our hope that our patients are able to move on. Like, we're always sad to see them go, and we're here for them as long as they need it. But it's our hope that we get you well and equipped and you're able to progress in life. But
what's the best way to kind of initiate the conversation?
Yeah, absolutely. So you find yourself with a chronic disease and you're unable to afford insurance, you simply call MLK 318-227-2912, extension 3. That's going to put you through to Miss Sue, and she's going to walk through just a couple of eligibility questions just to make sure that you're going to qualify. And then within 2 weeks, we're going to have you in to see your provider. And we do have some paperwork that you have to submit, but we give you 3 months to get it all in. But we try to make it as seamless as possible because we know you've got enough going on and you just need someone to help you. So we try to make that easy. But maybe you're unsure if you qualify. Maybe you're unsure if you're the right quote-unquote candidate. Just call. And if we can't help you, we have people on our team that will do everything they can to help you find the care that you need, the help that you need. And that's one thing that I will tip my hat to my team. I've worked in other places where, you've got 1 or 2 people that really care about what they do, and then a couple of people that, they care enough, and then a couple of people that are just there for the paycheck. I have a team of, I think, 11 people, and every single one of them are there because they genuinely and deeply care about the people that we serve, and they go above and beyond. Sometimes I have to rein them back in, like, that's a little bit beyond, what we're able to do, but they will move mountains for the people that we serve because they genuinely care about their well-being and genuinely want them to be healthy because they understand the ripple effects that when you're healthy, your family is healthy, and you're able to, show up for your family and your community in the way that you want. So if we can't help you, my team will help find the people that can help you because we don't want anyone to ever feel alone when it comes to their health struggles. So I'm very proud of my team. We do have a couple events coming up. So in June 18th, we have Guys Night Out. So this is an event just for men to come. Maybe you don't have a chronic disease, but you don't have health insurance and you haven't been to the doctor in a while and you just kind of want to check in. It's a free event for anyone. And we welcome, men who have health insurance, but maybe they went to the doctor and the numbers were a little bit elevated and they just want to kind of check in to see how they're doing. this is the event for you. We'd love for you to come. Let's get those numbers checked, because we know, I think it said, I've done some research, I think like over 40% of men don't go to the doctor until it's a serious health issue. So let's do better, guys. Let's come out. It's just going to be an event for the guys. Let's get your health numbers checked. Make sure you're doing good. If there's some issues, we're going to get you plugged into a clinic at MLK to make sure that if your blood pressure is elevated, that we're getting it to a healthy range. If your glucose is high, making sure that you don't have diabetes. So that's coming up. And then in October, we have an event for the ladies to come out and get their mammograms and their well woman exams. But like I said, MLK, we're always here. We have weekend appointments. We have evening appointments, because we understand you're uninsured, you don't have health insurance, and you have a job that does not care, and they're not going to give you time off. So you can have a free clinic 8 to 5, and if you don't get off till 5:30, you're still just going to go to the emergency department, because you're not going to lose out on your pay. So we've thought about those things, because we want to make sure that you have not just coverage, but access. And so we've done the best that we can to think about the barriers and the challenges that our patients face, and then build our clinic around that to make sure, you work nights, well, we've got daytime appointments. You work during the week, well, we've got Saturday appointments. You can't come on Saturday, but you can come in the evening. We've got you covered. Yeah. So, like I said, I really am proud of the work that we do. I want to tip my hat to Dr. Jackson and Sister Margaret, who had the courage to see a problem and say something about it, and to just show up on Saturday, and then to show up on the next Saturday. And here we are 40 years later, still caring for our community, and we are here and we are ready to help. Yep.
Thanks, Jordan. Well,
of course.
You love Shreveport, and Shreveport definitely loves MLK, and you guys have such a heart for this community.
Absolutely.
So appreciate all the amazing, incredible work you guys do, and look forward to continuing our work with you.
Thank you so much.
Absolutely. Thank you.